My name is Dr. Taryn Lowery. I'm one of the chiropractors at Peace of Life Chiropractic, and I want to talk to you a little bit today about the Webster Technique. So the Webster Technique is part of the reason that my career led me into pediatrics and pregnancy specifically. So whenever I was an intern at Parker University, I was being mentored and I guess coached by Dr. Nicole Liederman, and I was gifted with a pregnant patient. The mom was a hardworking mom. She's a respiratory therapist. She was working at night. There was a lot of stress in her life, and baby was breech. And so we worked consistently with her to get everything lined up. Dr. Liederman incorporated the Webster Technique into my care with the mom, and with that, I got to feel the baby Taryn at 37 weeks. I literally felt it with my hands. It was truly a magical moment. I knew right then God was saying, you're not going to be a horse chiropractor, you're going to be a pediatric and pregnancy chiropractor. I'd like to tell you a little bit about the Webster Technique. I incorporate it into all of my pregnancy and prenatal care. So with that said, the Webster Technique is ultimately, it was designed by obviously Dr. Webster, who was the founder of the International Chiropractic Pediatric Association. Their website is icpaforkids.org. It's a great resource for you if you're expecting mom, or you're maybe in the fertility stages and things like that. It's just a really good way to start to build some knowledge about chiropractic and how it relates to pregnancy and even postpartum and newborn care. So with that said, Dr. Webster discovered as he was working actually with his own wife that there was a relationship in the body between the sacrum, the uterosacral ligament, and then the uterus, and obviously the round ligament and the pubic bone. So I'll show you all those things in just a second, but with that said, the relationship between those is something that we focus on in pregnancy because there's such an intimate balance between those. And with the presence of harmony in those, it really helps statistically to improve birth outcomes. It helps reduce dystocia, it helps reduce pelvic floor trauma. Most everybody knows that with a proper or optimal fetal positioning, that birth outcomes are just improved. So not only that, we found in our practice and then even statistically through the ICPA that birth outcomes are more favorable. There's less dystocia, there's less pelvic floor trauma, all those things that we just discussed, but that even labor time is reduced. There's so many things that are improved, and I really have a passion for moms because I am a mom, and I had 2 births of my own, and they were both blissful and wonderful and uncomplicated, and I know what that feels like, and I try to empower moms to be able to have that. So one of my tools is the Webster Technique. So I want to show you a little bit about it. This is obviously a model spine. We all know the uterus lives right here. The uterosacral ligament connects the inside of the sacrum to the back side of the uterus. Then obviously there's the uterus. Then there's a ligament called the round ligament that attaches from either side of the uterus onto the pubic bone. So you can tell that if there's any distortion, whether it be in the pelvis or in the sacrum or those round ligaments or the uterosacral ligament, that it can cause some stress for the uterus and for the pelvic inlet in general. So it can cause round ligament pain, there can be lots of pressure across the bottom. I've actually seen a lot of moms who have like a distorted fetal positioning, so baby's all to the right or all to the left, and you can actually see the distortion just by visually, assessing them. With that said, whenever we do the Webster Technique, we obviously assess the position of the sacrum, we assess the position of the pubic bone, and then also the round ligament, because it's actually it is the only ligament that has muscle in it. And so that muscle can contract as well as there being obviously just tense or taut on the ligament itself. So with that said, we assess all those areas, correct those areas if there is an imbalance, and then after that we take care of the rest of the spine, check everything through thoroughly once more, and then mom goes on and enjoys her pregnancy. With that said, if you have any further questions about the Webster Technique itself, about prenatal care or care during fertility or even postpartum care, we would love to be able to help you and serve you during that special time of your life. So we'll leave the contact information in the comments. So if you have any questions, feel free to contact us that way. Thank you so much. Have a great day.